Hi, this is Julie from Lady Bits. Today's video is all about prolapse, pregnancy, giving birth, and how do I do it without making things worse? I've had so many women reach out to me who have so much fear around birth because they know they already have a prolapse from their first birth, or they recently found out they have a prolapse in their second birth, and they're really afraid, how am I going to not make this worse? How am I going to get my baby out? So ladies, this video is for you. I wish I could see you all in person, but I hope this helps. So the whole idea here is, how do we reduce the pressure on the pelvic floor during birth? How do we reduce the pressure on the pelvic organs during birth so that you can give birth without really feeling like you're going to completely blow everything out the bottom side? So let's remember one really key part of giving birth is the surrender. If you're lucky enough to give birth in an environment where no one is causing anxiety or fear, or no one's bossing you around, and you can really dive deep into the wisdom of your body and rely on the oxytocin from your brain from pain relief, if you get to stay in control and have a natural birth, it gives you more options with your body, and it actually gives you a little bit more control. There is no judgment out there for those of you who might need to use epidurals or other pain relieving measures, or even end up in an emergency C-section. This is not the place to judge. This is simply the place to prepare. How can we prepare for all these different scenarios? So what a lot of women don't realize is how mechanically this baby's going to come out. So let's cover that a little bit. So first off, you've got your belly full of baby. Now your pelvic floor doesn't really fall out like that, but you've got your belly full of baby, and we need baby to enter into the pelvis and then come out the bottom side. So labor has multiple stages. There's, that first stage that can go on for days and hours of getting the baby deep down into the pelvis until the head finally meets your pelvic floor and you get to push. So how can we ensure baby can get into that pelvis? Because how many times have I heard a woman telling me that she felt like her pubic bone was being rammed every time she had a contraction? How can we comfortably at least get the baby in the pelvis with a little more ease to make the next stage easier? So let's talk about biomechanics. Let's just talk about how to open your pelvis just a little bit more. Now, hopefully you've been getting prenatal massages and doing prenatal yoga and doing stretching and deep squats and all those wonderful things to help prepare your body and your pelvic floor. Now, what I often have my pregnant mamas do at home, pardon me while I go grab one, is I have them get a little pinky ball. This is blue, but the ball is called pinky ball off Amazon. And I have them start to prepare these muscles here for the big giant stretch of getting baby out. But I'm already ahead of the game, so pause there. Let's get the baby in the pelvis first. So we need the baby to go in the pelvis. So biomechanically, ladies, if you're at home and you're pregnant, do this with me. I just want you to feel what it feels like in here when your legs, and you can even be sitting, when your knees are really wide and your ankles are together, do you feel like things kind of open a little bit? Because they do. And you could take advantage of knowing, wow, when my knees are wide and my ankles are together, my pelvis opens up in the top. So you can take advantage of that with, hold while I grab my big ball. You can take advantage of that biomechanics in labor. So you're getting all hot and sweaty, things are moving along, and you want to get the baby in the pelvis. One of a really lovely positional technique you can do is, you're going to notice I'm going to really splay my knees out, but I'm going to put my ankles together. And then you might just find just this is really relieving and really comfortable. You can rock, you can sway, you can go back and forth, you can use your partner's knees, you can rest on their knees. The idea here is your knees are wide, your ankles are together, and this isn't early, not pushing yet. You just want to help the baby dump into the pelvis. So, I mean, oh my gosh, you can use that, just standing with your, with your knees wide, swaying back and forth, hugging your partner. Knees are wide, feet are together a little bit or even wider. Just getting baby to engage in the pelvis. So just knowing that, it's going to help your baby, like, whoo, knees wide, ladies, get baby in the pelvis. Whether you're on your knees or standing or rocking or swaying, knees wide helps dump baby in. Now, baby has dumped in, and it's that big moment where baby's head is right there. How do we reduce, whoa, hopefully your pelvic floor is not flying out of your body the way mine is out of this model. How do we reduce the pressure on the pelvic organs? If you have prolapse, vulvar varicosities, how can we do this with less pressure so that we're not encouraging further distension of these organs? Well, there's a couple components. You want to have a nice relaxed pelvic floor. These are not the muscles that control peeing and pooping. These are not don't fart at the pool, don't pee at the party muscles. These are deeper than that. These are your lifters. And they will turn on and contract every time you blow. So you may have in the past felt, okay, when I inhale with my filling, oh, I can feel the muscles relaxing, because they do, and you can feel that in child's pose really beautifully. And when you inhale and your belly fills, your pelvic floor will naturally relax. So knowing that, okay, if I inhale, everything relax. How do we stay relaxed on the exhale, and how do we keep these muscles relaxed? Because for your glorious baby to come out your wonderful hole, these muscles here that start at the tailbone, they extend all the way and they attach in the pubic bone, they're gonna have to stretch 250% times their normal length for baby to come out. So step one of being prepared for birth is, how do we keep these muscles soft and relaxed? And that is where you grab your little pinky ball from Amazon. And you may have seen this in a coccyx video I released a while back, but I say, you know, we're gonna grab that bone we sit on, and it's this guy. There's the bone. You place the ball in between the bone and your butthole. Like, not on the bone, in between the bone, because when you do that, you've placed the ball right on those muscles, and you can actually just sit on it that way. So I always teach my patients, you know, get in a squat, feel that bone you're about to sit on, and stick that ball right inside of that bone, just to the inside of that bone in the butthole. Woo, there it is. It's gonna be one-sided. And you wanna sit on kind of a firmer chair, and hopefully your feet are flat, and you just breathe, exhale, and melt. You allow yourself to melt over the ball. Now this is preparing these muscles for this big stretch. Now most of my ladies need to sit on the ball on each side for at least a minute, breathing and melting, breathing and melting, breathing and melting. And I always hope they start this early in the 3rd trimester to get these muscles, and they're already kind of soft and squishy, getting used to what's about to happen. But I really want to make sure they're really soft and squishy and you can feel them relax. Now you won't necessarily feel it while you sit on the ball because you're just breathing and melting. You'll feel it after about a minute of breathing and melting when you take the ball out and you sit and go, oh, I feel really wide open. It's a really lovely thing. So this is good for anyone with a tight pelvic floor, and it's really lovely if you're preparing for this beautiful opening your body's going to do for birth, to have, you know, each side you sit on the ball, you breathe and melt every day. It's just a lovely way to prepare these muscles to open up and let your baby ease out gently. Now, a lot of women tell me in those last few weeks right before birth, sitting on a ball is not comfortable because they feel like their baby's head is right there, and I say then stop doing it. You've already done the work, you've prepped the muscles, you've stretched them, your body's telling you intuitively, ooh, I don't like this anymore, then you get off the ball, because like everything I've ever said in any of these videos, if it hurts, if it feels uncomfortable, if it causes your intuition to go off, you don't do it. So good little prep, not an absolute must for birth, but it's a good little prep if you happen to have access to a cute little ball. Now, how do we get our head out without doing the mistakes that so many women end up doing? And mistakes because of bad coaching and poor understanding of the biomechanics. So historically, if you watch a lot of movies or TVs and you see women giving birth, you often almost always see the image of the woman on her back with her knees pulled up to her chest, and she's going, and she's doing that crazy thing. Try to avoid that. So here's the important thing to know biomechanically. If you are laying on your back during birth, your sacrum and the tailbone gets pushed closed, and now your baby has less room to get out. If you're in any other position, or even laying on your side with an epidural, now your sacrum can open to let your baby out more easily. That means less bearing down, less pushing, and less pressure. Your body mechanically is softening these ligaments around the sacrum specifically so your sacrum can scoot and move and nutate and get out of the way for your baby to come down. And doctors will often say, get on your back and push, because it's so convenient for them to catch. Who cares what's convenient for them? Don't be on your back. Unless your body says, I really want to be on my back. If you feel you want to in that moment, go with your intuition. But if you have the freedom of movement to be in any other position that's not on your back, biomechanically, you're already making it easier for your baby to exit, which means less pushing and less straining. So understanding that biomechanical fact, get off your back. You can be on your side, either one. Usually the left is a little bit easier, but who cares? If you've got an epidural, you can just keep shish kebabbing sides so that you're not blocking that sacrum. Now, pushing. This is tough because in the moment, you may have no control. Your body might take over and do it for you. So awesome. Let your body do what it naturally wants to do. Women in ideal situations don't have to push. I say ideal because we're not always in an ideal situation. If there's fear, if there's anxiety, if there's medical staff hovering around you, scaring you, it's no longer ideal, and your body goes into a different state of being, and it's really hard to relax and just surrender to the process and let your body do what it naturally does. But so many women will tell you, I didn't even have to push. It just kind of took over and did it for me. And those are the women that have these really lovely, non-traumatic, just, oh yeah, my baby just came out. Wouldn't that be nice if that happened to all of us? Now, it's not necessarily going to happen for all of us, but if we go in with a little empowerment, we can go in with a little less fear. So, how do we avoid pushing? How do we avoid increasing the intra-abdominal pressure that adds to worsening of prolapse or potentially tearing the perineum? I've been really lucky to work with some really incredible women who've taken my suggestions and tried them and come back saying, oh my God, it totally worked. Now, not with every single one 100% because everyone's body is different, but I encourage you to try this. Get rid of the old idea of holding your breath and bearing down with all your might, like many doctors and nurses would end up coaching you to do. And certainly do not hold your knees at your shoulders. If your knees are at your shoulders, then these pelvic floor muscles are put on the absolute most possible, biggest stretch possible. If they're on a really big, huge stretch, it makes it even harder for your baby to come out because now your baby's coming out of something tight. You want your baby to come out of a very loose, open door. So when your knees are at your shoulders, that's not loose or open. That's really tight. So I'm going to make a few recommendations positionally wise. So we're going to get off our backs and on our sides. And you can just lay flat on your side, or you can even use a pillow. So you can put a pillow under the hip and you can be on your side. And now instead of having knees here, you can have your partner hold your leg like this. And my favorite is like this. And here's why. Laying down at home, you might already feel this. When your ankles are together, your back door is closed. Your ischial bones, these two bones here, they're actually closer together. And you want to make as much opening as possible for the baby so you don't have to push. So you might feel this on your own, that when your ankles go further out, your ischial bones spray apart, and it's actually much easier for things to come out down there. So if you're laying on your side, and especially if you have a pillow propped up, now this knee drops down and that ankle drops down, you can just have your partner hold your leg like this. Again, not like this, putting these in a tight stretch. Keep them nice and soft and loose, and have your partner hold your ankle above your knee. So if you play around with this at home with these different ankle positions even before you go into birth, you're going to feel, oh wow, when my ankle's up high to the ceiling, my back door is way open. But when I drop my ankle down, things get really tight and closed up down there. So you want to create as open of a door as possible for this baby. So say you're on your hands and knees in that wonderful moment. So same concept. Knees together, well not together, but under hip, and then ankles really wide and apart, because now again you've got that door wide open. Now someone with a prolapse wants to really reduce the amount of pressure on their pelvic organs. So we all heard, oh, gravity helps get baby out, use gravity, use the birthing chairs. They are helpful, they add gravity. However, they can be a little too quick sometimes, or they can be a little too much pressure. So I usually tell my patients with prolapse, let's try on your side or on all fours, because now you're horizontal and there's less downward pressure on your pelvic organs. Your uterus is absolutely strong enough to push your baby out, and your baby knows how to wiggle and scoot and move to come out. Really, our job as women is to try and stay at peace and try and stay relaxed and keep the birth door open. So those are kind of my two favorite positions: hands and knees with your ankles wide apart, or laying on your side, again, with your ankles wide apart to keep the back door open. And then the final tool is, how do I breathe my baby out? How do I avoid this? Because we definitely want to avoid that. We know it increases, fetal heart rate. Babies tend to go into distress and the doctors freak out, and then women end up with emergency C-sections. We really want to avoid that, or it can cause worsening of prolapse or even prenatal tearing if things go too quickly. So I'm going to try to show you how I teach my mamas how to breathe their baby out. And it is reversing normal breath mechanics. So this is a little bit hard. Now, normal breath mechanics are that when you inhale, your belly fills, and when you exhale, your belly contracts. Now that's normal. And with those normal mechanics, when you inhale, your pelvic floor relaxes, and when you exhale, it naturally tightens and lifts back up again. But if we want baby to come out, we want to keep the door open. So as hard as this might be, and I'm going to have you practice laying down, sitting down, and standing up just to feel it, but I'm going to show you standing up so you can see it. I have my ladies practice inhale their belly full, and now keep it full as you exhale. It's really hard to do. You're essentially almost breathing out and down into your hands. If you've got a pregnant belly, I always have my ladies put their hand really low. I say inhale into that space. Exhale into your hand. Now you see my belly didn't shrink that time because I was actually gently pressing my belly out into my hand. I was reversing the normal mechanics. I was keeping everything open, because when you can keep your belly down and out, your pelvic floor stays down and out. So your whole breath cycle becomes one of complete pelvic floor relaxation, where you're breathing in into your hand, you're breathing out and down into your hand, and your pelvic floor is staying wide open. You can feel this when you sit in a chair pretty well. You can feel this when you're laying down. Pay attention to your vagina. Pay attention to your butthole. Do you notice that when you get that mechanically right, when you can breathe into your hand and exhale and blow down and down into the hand? I say breathe down, but don't breathe in such a way that it pulls in. You can kind of see how things are gently bulging out. By using your breath, you're turning off your pelvic floor muscles, you're letting them stay in relaxation, and with every breath you take in the pushing phase. So this isn't to be used during like 0 to 10 centimeters. This breath is to be used when it's time, when baby's head is down there and it's time to help ease baby out. If you're really afraid of pushing, give this a try. It's what I call down breathing, and you can practice it when you're sitting on the ball, because you can kind of feel everything relax around the ball when you practice it. I like to have my ladies practice it every night when they go to bed in their 3rd trimester to make it feel really automatic. So when it comes time to being in that birthing space, when you're in kind of your animal brain, you're in your subconscious brain, you're no longer conscious. Women just disappear consciously in the birth room, and thank goodness they dive into their ancestral knowledge of how to, go through this incredible process. We can't be thinking hard. Now, what did Julie say in that video? How am I supposed to breathe? It's already too late. If you have to think about it, it's already too late. I want this to become automatic for you. So between now and birth, you can inhale into your belly, exhale, press your belly out. You're going to feel everything turn off and relax. If you have a full bladder, you might even feel yourself open and leak, because this opens all the doors. So pee first before you try this. But yeah, try it every night. Try a couple minutes, laying on your side. You can practice it in different positions. Let it become automatic for your body, so that when the big moment comes, you can just go right into it. You're on your side. You're on hands and knees. You can breathe your baby out nice and slowly. Let your uterus contract and do the work. Let your baby wiggle and do the work, so that you can greet your baby without fear, without trauma, without having pushed everything down and out. Maybe you can breathe down for 80% of the time. Then maybe that last 20% your body takes over and says push, and you push that last 20%. look at all that good work you do. You saved yourself 80% of pressure. So maybe you don't do it 100% of the time. Maybe your body takes over at a certain place. But I've had a lot of women do really well with this technique, and I really hope it helps you. Midwives have told my patients, you have a magic vagina, and I love hearing that because it means they absolutely were able to let go and breathe down and let their baby come out. I hope this is a helpful video for you. I hope it answers some questions and prepares you with a little more confidence going into this labor with a prolapse, knowing that you can stay in control, you can be in control of your biomechanics, and you can be in control of your breath. And just knowing just that can give you such a great tool towards welcoming your baby with less fear. I hope this helps, and I wish you the best birth ever. Take care.